The following program is sponsored by the Medicine Center Pharmacies.
Good morning and welcome to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. We're very glad you joined us. Before we begin, I'd like to thank our sponsors, Studio Arts and Glass, Chemthorne Motors, and of course our technical producer, J.D. DeAngelis. This morning in the studio with me is Nancy Warmby, Medicine Center Pharmacy's Executive Vice President, and our very special guest, Dr. Rizwan Sardar. Am I close? Very good. Right. Okay. Interventional cardiologist from Altman Specialized Heart and Valve Center. Thanks for joining us this morning, Doctor, and welcome to the show.
Thank you for having me, Paul and Nancy. Really appreciate this opportunity, and definitely will be looking forward to any kind of questions that you have on the matter of atrial fibrillation.
Atrial fibrillation, commonly known as A-Fib, is a quivering or irregular heartbeat that can lead to blood clots, stroke, heart failure, and other heart-related complications. According to the American Heart Association, 2.7 million Americans are living with A-Fib. Treatment options range from medications to non-invasive, as well as surgical procedures. Today, Dr. Sardar will talk with us about A-Fib and treatment options, including a relatively new procedure, the Watchman Device. I'd like to remind our listeners that today's program is also available on our podcast, which can be downloaded from the App Store on your mobile phone. Look for Health Matters with the Medicine Center Pharmacy, and you can listen to any of our programs anytime. If you have questions during today's program, we invite you to post them on our live Facebook feed or call us at 330-450-1480. And we should congratulate Dr. Sardar as well, as he's a new father, 2.5 weeks, with a new baby girl.
Thank you. We can show that child on Facebook.
I think we should, because she is beautiful.
Thank you.
So, Doctor, what is Altman's Structural Heart Program?
Paul, this is basically a program which I would probably call it still at the infancy stage, probably just because of the age when we started. We started this program in 2016, late in October or December. This is a program where we do many kind of heart diseases which were supposed to be done by open heart surgery, and we are doing it in minimally invasive way. For example, valve replacement, valve repair. There are all different kind of valves that can be repaired and replaced without somebody having a chest cut or an open heart surgery. This program was started at Altman in 2016, like in October and December, in that range, and we have evolved now, establishing new treatment strategies, which includes not only Watchman Device, which we will be talking about more in detail, but also some people are born with birth defects, like they have holes inside the heart in a layman term. They sometimes also have critical conditions for which they would be needing a heart transplant, or they will be needing an eventual heart support, which can be performed without an open heart surgery to be a bridge for the further treatment strategies. So this is a kind of a program where we are performing all those surgical procedures in a minimally invasive fashion.
You know, we've had many guests on this show in the past 7 years, and I wonder, is there ever a perfect human being born? I mean, there's so many different ailments that can, come with the person when they're born. Have you ever seen any perfect humans? I
think he may have seen one 2.5 weeks ago.
I know. I look at it, thinking about this, last night, about all the individuals we've had on the show and all the different ailments and all the stuff, and some of the stuff is just really horrible that people have to deal with. But,
correct.
And the heart, and then you see people out there that are 98 years old and 102 and all that sort of thing, and aren't taking any medication. So,
yeah, I certainly feel that first of all, we all are blessed to be as perfect as possible. Yeah. I certainly feel for myself as well, and I feel that we have a responsibility for those who are not as fortunate as we are to basically devise and find out solutions to improve their health quality.
Is not, from the country you're from, is not the length of life longer? I mean, I've read some things.
It is considerably shorter.
Is it really? Okay.
It is considerably shorter, and that is why I feel like as a country here, we should feel fortunate what we have available here.
Sure.
In terms of medical treatment opportunities, in terms of the health progression of research, and building up new strategies to basically cure the ailment, or at least provide a solution to improve their life and quality of life, which is the most important thing.
Okay, so your program, where is it located? Is it actually in the Altman main hospital?
Correct. I basically tell all of my patients, because sometimes they try to find out, or sometimes they try to get themselves transferred. I only work at Altman main hospital.
Okay.
Unfortunately, the program that we have, it requires a very big infrastructure, and it is very difficult to replicate at many institutions. Just to give an idea and perspective for your listeners, the structural heart disease program is only offered in 3% of U.S. hospitals. So it is very uncommon. And it is right now, we are not at this stage that we can replicate this thing completely at different Altman centers, but we have enough staff who can manage and bring the patient to the main Altman center. That is what we are actually striving to, and improve this thing so that the whole community and surrounding communities can benefit.
Yeah, historically, many of the physicians that worked in hospitals had outside offices. Now, your office and most of the cardiology team in the building.
You're absolutely right. I think you are going in the right direction. We have a very big network of outreach hospitals and outreach clinics. I have partners in my team who are like general cardiology, and they're almost like 18 to 20 people. They go out in different communities. They see patients. They all are familiar what structural heart disease is, and if somebody really needs our help, we have a network which actually help in getting these patients to basically come to my clinic, or I see them in the hospital, or some of my members of my team see them in the hospital.
Well, we have physicians now in the hospitals that are called hospitalists. I guess I got that word right. But your team of cardiologists would be the only physicians that would see cardiology patients. Is that fairly correct?
In a way. Hospitalists are those individuals and those physicians who generally treat all medical conditions.
Sure.
Our team, especially cardiology team, takes care of all cardiology issues, but my team, which we are going to tell you more about, specifically take care of structural heart disease cases or somebody who need minimally invasive surgeries for the heart.
So who are the members of the structural hospital team? We just a little brief discussion here about that, but
correct. So when we started off, as I told you, that we were only two people. One was a surgeon, Dr. D'Agostino, and I basically started up this program at Altman Hospital. But now we are fortunate that we have 3 surgeons already on board. We are having another surgeon who's coming to join us. So after all this, we'll be 4 surgeons, one me, which I'm an interventional cardiologist, and another electrophysiologist, Dr. Hamden. So we are we will be 6 people, 6 physicians who will be basically the part of the structural heart team.
Are there some specific hospitals in this country which train more cardiologists than others?
Correct.
Like Johns Hopkins and I can't off the Cleveland Clinic. Some of the others. Those are the ones that we hear talk about mostly.
You're absolutely right, and I have a strong belief, and I was trained at a different institute as well before coming to Altman. I used to work in Northeast. I was at Brown University, and before coming here I was trained at Hopkins. But there are different places who are training different kind of cardiologists. But the whole important idea of our Altman Hospital team and cardiology group is that we should also try to build new trainee for this community.
Sure.
And we have already in place a cardiology fellowship program, which basically had its first graduation last year, and we are about to have a second batch of graduates coming up. So our interest is not only basically performing state-of-the-art work, but also to train the future cardiologists to meet the demand of the community and what community really needs, and probably help the whole world.
Sure.
Wherever they go.
So some of the procedures that are covered by the structural heart team.
We do all kinds of valve replacement and valve repair. Most often, people are familiar with aortic stenosis or aortic valve surgeries, which are traditionally done with an open heart way. We do these valve repairs and valve replacement for mitral valve, aortic valve, pulmonic valve by going from the groin without open heart surgery, replacing the valve or repairing the valve, and in 60 to 70% of the time, the patient is awake. The patient is talking to us during the whole time.
Amazing.
And they have very quick recovery, and they basically go home. 95% of the patients in our hospital, they actually went home, and I would repeat, home, not rehab, in 2 days.
Wow.
So this is very remarkable that what kind of recuperation patients get. Going further along, we have developed a shock program where people who have terrible heart disease, that they're coming with acute heart attacks and they need life-saving mechanical circulatory support. In other words, they literally need an artificial heart so that we can bridge them to a better option or a better treatment, which may include transplant, which may include destination support devices. And we have started this program very successfully by the same time I came in 2016. And finally, now we are also taking care of patients who have congenital abnormalities, like they're born with birth defects. And for those kind of defects, they might need to actually go for open heart surgery again. Like some people have strokes, and they are silent strokes. They never know, but in fact they have holes inside their heart, and we actually close those holes without open heart surgery. And last but not the least, which we'll be talking more about today, is patients who have abnormal heart rhythm, in very common term nowadays. In fact, I think this word is now a layman word. It's called atrial fibrillation. People who are not good candidate of blood thinner, they can be prevented with a stroke without taking a blood thinner with this new device, which is basically left atrial appendage occluder device called Watchman Device. We are doing it now at Watchman Hospital as well.
Okay, time for our first break. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
Allergy season is here. That means itchy, watery eyes, nasal congestion, and sneezing for people who suffer from allergies. Whether you're looking for an antihistamine or an all-natural remedy like Allercom, which has been proven to help manage allergic and asthmatic symptoms in both children and adults, our Medicine Center pharmacists can help you find relief from your allergies. The Medicine Center pharmacies are located in Canton, Louisville, Minerva, and New Philadelphia. The Medicine Center Pharmacy, where wellness begins.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
Hi, Paul White for the Medicine Center Pharmacies. If you had chickenpox, you are at risk for shingles. Shingrix, the new vaccine for shingles, is now in our pharmacies. Did you already get the other shot? Shingrix is more effective, and you will need to get a 2-shot regimen. Talk to your Medicine Center pharmacist and learn more about this new injection. The Medicine Center pharmacies at Canton, Louisville, Minerva, and New Philadelphia, where wellness begins. See us on MedShopRx.com.
Brighten your day with beautiful stained glass from Studio Arts and Glass. Let the sun shine in through a stunning beveled glass window that forms a rainbow on your walls. Commission a piece of art to cherish for years. All at Studio Arts and Glass on Apple Grove and 77 in North Canton. Open Monday through Saturday, 10 to 6, or shop online at StudioArtsandGlass.com. That's StudioArtsandGlass.com.
Welcome back to Health Matters with the Medicine Center Pharmacy. Today we're talking with Dr. Rizwan Sardar, interventional cardiologist from Altman Specialized Heart and Valve Center. Have a question, give us a call at 330-450-1480 or post your question on our live Facebook feed. So, Doctor, what are the causes of atrial fibrillation? Who's the most susceptible, and how many people suffer from A-Fib nationally?
That's a great question, Paul, and we were just briefly talking about this before as well, but atrial fibrillation, the most important cause that is at this present time known is actually age. We exactly are not sure whether it's a cause or it's just a consequence of just getting older. However, on the other side, people who have known heart disease, like if they have a coronary artery disease, if they have a valve problem, if they have some other electrophysiological problem, like in layman word I call it as electricity issue in the heart, they are more susceptible to have atrial fibrillation. In general, in my mind, if anybody above 65, especially in female gender, it is very common to see it. Causes could be heart-related, causes could be not related to heart. Sometimes atrial fibrillation is temporary, which could be due to our dietary stuff, for example, excess caffeine, sometimes excess stimulants.
No, wait a minute, caffeine's supposed to be good for you, and then next day it's bad for you. What's the deal?
Moderation is best. But I do see excess stimulants causing atrial fibrillation, especially in young patients, especially in college students.
The high level, the high caffeine products.
High caffeine.
Yeah.
And some endocrinological diseases.
So, what about patients with A-Fib? Are they at risk for other medical conditions?
Yes, they are certainly at other risk of medical conditions, and I forgot to answer your previous question that how many people suffer from atrial fibrillation nationally. As Nancy said it in her opening statement, that it's about like 27 to 30 million people annually suffer from atrial fibrillation. It's an epidemic kind of a situation right now. Now, people who have atrial fibrillation, they go along with many other diseases, which basically they hold hands together and they go along and they're not good, especially heart failure. Heart failure is the biggest epidemic after the cancer at this present time. There are different kind of varieties of heart failure, and very often it is contributed by atrial fibrillation. And heart failure, beside heart failure, if you calculate that what's the risk of somebody dying just because of atrial fibrillation, it is astronomical. And the stroke. But when you combine these two factors, some research have shown that it is probably worse than having some malignancies or cancers too. So it's a major deal. It's not a small thing.
Oh, okay. So we have all this stuff in our chest, okay? We got our heart, we got lungs, we got our stomach, which is, below the cage, that sort of thing. And there's just so many ailments that like acid reflux, and I can't think of any others right now, but that would maybe mimic heart issues. How do we ferret all this out as an individual?
You are 110% right, and in fact, there are many times these conditions are mimicker. And in fact, not very long ago, I basically take care of emergencies. I saw one patient. She basically came with abdominal bloating. That was her only symptoms. And she was found to have a heart attack. Everybody is different, but we try our best that we educate and we try to discuss the most common things. Of course, we cannot deal with all atypical things, but people do have mimickers. Atrial fibrillation, I will tell you that there are most common sign for atrial fibrillation when somebody have it. There are 50% of the people, they feel it. They feel heart pounding, heart beating irregularly. Sometimes they feel the heart is beating in the neck. Atrial fibrillation, rest of the 50%, they do not feel it. They have very non-specific symptoms. But the most common non-specific symptom that people do complain about is general fatigue and just being tired, having no energy. And if it goes long, then they feel short of breath or leg swells up. I would probably say that if somebody, I'm talking about very general comment, it's not specific to almost all the patients, but if somebody is feeling excessive tiredness and they're above 60 and 65, they should probably think about atrial fibrillation or something is wrong with them and get them checked either with the primary care doctor or with a cardiologist if they have already. But primary care doctors are very familiar with atrial fibrillation. It is one of the most common presenting diagnoses in the emergency rooms.
So how do we treat A-Fib?
The treatment of A-Fib has multifaceted approach. One is this, that we need to reduce the consequences of A-Fib. And this is probably the most feared consequence, which is basically stroke. And I always tell my patients, you don't want your enemy to even have that, because it's basically end of your life. I had a patient, we do all these procedures, and there is a risk of stroke that, and I clearly remember his statement. He told me one, and that was very moving for me, that he said that, Doc, I'd rather die rather than having a stroke. And I feel this is very moving for me as a physician, because the last thing you want to for your patient to have a stroke, which is debilitating. Atrial fibrillation is the biggest cause of the stroke. There are multiple causes of stroke, but right now in the United States and probably in most of the developed countries, atrial fibrillation is the leading cause of stroke, which is preventable. We have anticoagulation. In short, we have blood thinners available, which have shown to tremendously decrease the risk of stroke. And this is probably one of the best find in mankind sciences. Now there are new treatment strategies that are available for those patients who are either by self, they don't want to be on blood thinner, or they are not a good candidate of blood thinner, and we can prevent a stroke by not giving them a blood thinner, which is basically Watchman Device.
I see. Okay, bottom of the hour, time for the news, and you're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
We understand the one-size-fits-all approach doesn't always work. We do customized compounded medications based on your doctor's prescription to match your specific needs. Hi, I'm your pharmacist, Brad White, from the Medicine Center Pharmacy. Do you use or need customized compounded prescription medications because of allergies, special formulations, or need an easier way to take your medication that isn't available? Many physicians choose to prescribe a medication that is not commercially made and requires a pharmacy like ours with special equipment and training to prepare a capsule, suspension, cream, or tablet. Are you sensitive to lactose, dyes, or need a sugar-free suspension? The Medicine Center Pharmacy is here to help you. Every day we prepare custom medications for infants, adults, and pets in our PCAB accredited compounding lab. Call or stop by the Medicine Center Pharmacy today at 551 West High Avenue in New Philadelphia, where wellness begins.
Spring is in the air, and it's the perfect time to shop Northeast Ohio's largest auto mall with one click at KimThorne.com. Mazda, Volkswagen, Volvo, Jaguar, Mercedes-Benz. Something for everyone's price range. And KimThorne.com makes shopping easy, fun, and friendly. Less than stellar credit? It's never a problem. We have a huge selection of pre-owned vehicles to choose from. The Kim Thorne family name's one you know and trust that's been committed to our community for over 80 years. Shop KimThorne.com.
Allergy season is here. That means itchy, watery eyes, nasal congestion, and sneezing for people who suffer from allergies. Whether you're looking for an antihistamine or an all-natural remedy like Allercalm, which has been proven to help manage allergic and asthmatic symptoms in both children and adults, our Medicine Center pharmacists can help you find relief from your allergies. The Medicine Center pharmacies are located in Canton, Louisville, Minerva, and New Philadelphia. The Medicine Center Pharmacy, where wellness begins.
Brighten your day with beautiful stained glass from Studio Arts and Glass. Let the sun shine in through a stunning beveled glass window that forms a rainbow on your walls. Commission a piece of art to cherish for years. All at Studio Arts and Glass on Apple Grove and 77 in North Canton. Open Monday through Saturday, 10 to 6, or shop online at studioartsandglass.com. That's studioartsandglass.com.
You're listening to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist and host, Paul White. Today we're talking about A-Fib and the treatment options with Dr. Rizwan Sardar from Altman Specialized Heart and Valve Center. We have a lot more to cover this morning, so let's get back to the show.
So, Doctor, during the break we talked briefly about wearable fitness devices and smartphones and how they can help with heart issues. Would you like to talk about that for a moment?
Yeah, Nancy, that's a great question, and I would probably just say that there is a new, the biggest problem with the atrial fibrillation, like we alluded before, is that 50% of the people do not know they have atrial fibrillation, and they have to bear the consequences of that. In those kind of patients, there are new research that is coming out, which is not conclusive of as of yet, but there are many of my patients who wear fitness watches, or they have some kind of apps on their phone to basically put on their heart when they are experiencing irregular heartbeat, or they sometimes, just as a curiosity, they check themselves while just getting trained. They found themselves and self-diagnosed themselves to have irregular or erratic heartbeat or fast heartbeat. I cannot say it conclusively that this is the way to go, but this is certainly a hot research topic to further accurately or, early detection of atrial fibrillation, if I should put that way.
Fascinating.
How advanced are the sort of over-the-counter, if you will, type wrist devices?
To my knowledge, there are different kinds of devices which are available in the market. Some are good for multifunctionality, depending upon the patient's or the person's choice, I should say. But I would probably say that you don't need to have an accurate heart rate, but you yourself know what your resting heart rate is like. And if it is something which is not regular for you, you can basically seek your doctor's help that, listen, this is not normal for me. I'm giving you an example. Like, for example, when I usually wear these watches and I'm sitting, my resting heart rate is in 60s and 70s. I know when I walk, it's in like somewhere like 110. If it is not in my norms and it is consistently happening, I think that person should reach out to the doctor.
I see. Standard pulse for most people would be 65,
70, maximum 80 at resting.
Okay, sure. Okay.
So when you joined us on the program last, the Watchman Device was very new. Now we're several months down the road, and it's still a new technology. Can you tell us more about it?
That's right. As I said before, atrial fibrillation has multiple treatment. One is heart rate control, which is basically to control the fast heart rate, and one is blood thinner to prevent a stroke. Now there is a new device which was very new at the time, and especially we were bringing it at Altman when I came last on your show. It's called Watchman Device. It's a device which is like a plug, and it is placed in the left atrium. When somebody doesn't know what the left atrium means, I generally tell the patient that heart has 4 big chambers. The 2 top chambers, which is on the left side, is the left atrium. It has a recess which everybody is born with it. I don't know why God has given us, but we all know that it is filled with a clot when you are in atrial fibrillation. And when clot can move north, which basically goes to your brain, you suffer a stroke. The biggest treatment that is being available at this present time is to just thin your blood so that you don't form a clot. Now it is available that you can have a plug placed in that recess to seal that off, so that this clot remains there, it doesn't go north into your brain and you don't suffer a stroke. This program has been started at Altman. Now we started this program in February, and this is going very strong. We have treated multiple patients so far, and it's been very effective, and I think a quicker recovery to get off the blood thinners for the rest of their life.
Do you feel that the Watchman device is as effective as alternative treatments?
Correct. Watchman device at this present time, and I should say not only the Watchman device, because you will be seeing more devices like Watchman device, but I should say that we are talking about a device which is basically a plug to seal off that recess for atrial fibrillation. It is as good as blood thinner in preventing a stroke. It is better than the blood thinner in preventing a head bleed or a bleed resulting to the fall or something from other nature of bleeds. This device has shown to be very least invasive, and it can be performed very quickly and safely.
Why would a patient prefer this device to blood thinners?
There are multiple reasons. I will generally talk about few which are the most common one. I see most of the patient who comes to me for this kind of a device, they have either failed blood thinner before for multiple reasons, like they cannot control their INR. It's very difficult to explain every patient what INR is, but in general I will say that you need to have a certain level of blood to be thin to be good for you. If it is more, it is bad. If it is less, it is bad as well. And it is cumbersome. And those kind of patients, they are tired of it. They don't want frequent blood draws. They want to have this kind of a device. Number two, there are patients who have experienced bleeding episodes in the past. Number three, there are patients who themselves feel like that I'm so frail that I have multiple falls in the past. If I'm going to fall again, I'm going to have a bad trauma and it can be life-threatening. There are a few other patients who come to me and they say that my doctor have suggested me, and I'm contemplating it myself, that maybe I should not be taking blood thinner, and that is what I call as patient choice. And yes, these are all valid reasons for having this device to be explored.
How do you determine if a patient is a good candidate for this device?
I determine it in this way, that first, they all should have a known diagnosis of atrial fibrillation. Number two, they all should be at an increased risk of stroke and at an increased risk of bleeding for multiple reasons. For example, they are frail. For example, they are at a high-risk job. Like I had a patient of mine, she's a cook, and she feels that she is a very high risk of job and she doesn't want to take a risk. Or the physician who are primary care, who are nurse practitioner, by the way, I'm talking about all kind of physicians here. They, in their medical judgment, patients should not be on a blood thinner, but they are at increased risk of stroke. They can be offered Watchman device.
Very good.
We had a customer years ago who was on the common blood thinner, and called up from, he was in Florida, called up and he said, I'm bleeding through the skin. It was so hot. And he left here in the middle of the winter. So apparently there was no discussion about adjusting his medication. So, I mean, you can imagine how freaked out this guy was. I mean, holy cow, going out my arm. So those are some of the things with these blood thinners that just never would have thought would occur. So how long does it take to install one of these devices?
Is it, if you allow me, can I just first of all tell you another thing about what you basically said?
Yeah.
I just want to give some statistics to your listener. What you basically suggested, that your one of your customer went to Florida and he basically experienced a bleeding issue. Just to tell everyone, that there is a very robust study out there which has shown that 35% of the people who should be on blood thinner in the United States, they are not on blood thinner for multiple reasons, which we just alluded to. And even the patients who are on blood thinner, they have experienced, at least 40% of them, one time or more than one time, a massive bleed in their life.
Wow.
And now going back to your question, this is a pretty slick and a quick procedure. This procedure can be finished within an hour. It is a same-day procedure.
Wow.
What I mean by same-day procedure is this, that they come electively into the hospital. They either go the same day home or they go next day home.
Do you see this as the future of this device is everybody having one, or large sectors of the population having one?
Yes, I feel like that this device will be explored in many ways.
Yeah.
There are already research trials going on in which, when we replace the heart valve, and obviously whenever we are doing an open heart surgery or we're doing transcatheter surgeries, which I do, we interrupt anticoagulation. And the time that you basically hold your anticoagulation, you are kind of a risk of stroke. And now they're exploring that people can get this device before they go for kind of surgeries that we do. So there are many aspects that this device is now being explored. And we are hoping to be part of one of the research trials which I just alluded. Yeah.
Okay, the blood comes back to the heart in the right atrium. Is that correct?
Correct.
Why this device, I guess I don't quite understand why this device is in an atrium. Why it wouldn't be in a ventricle where it goes out?
That's a great question. So I always tell that there are 100 causes of stroke. Atrial fibrillation, yes, is the most common. As at this present time, we know that atrial fibrillation is caused by collection of a clot that forms in that recess which sits in the left atrium. And this happens in 95 to 98% of the time.
The blood is flowing back in the heart slower from the vein
from
than
the
it goes
vein.
out from the ventricle. Is that
Correct,
accurate?
because when the atrial fibrillation happens, your heart is beating irregularly. It is not happening in a synchronized motion. Like, it's not like a synchronized
So
dancing.
maybe drop something where it shouldn't be dropped.
Correct.
Okay.
And it leads to blood to clot and doesn't flow freely.
Okay.
And this clot sits more often in that recess, which is in the left atrium, which is the top chamber of the heart.
But when we're talking blood clots, what's the size potentially that could cause a stroke?
It can be as small as microns.
Yeah. Okay.
It can be as small as that. And just to give an idea to somebody what is a micron is what you see under the microscope.
Yeah. Sure.
Yeah.
Is that the typical size of a clot, or?
It can be big.
Okay.
It can be as big that you can visually see. You can visually see under the echocardiogram, which is ultrasound of the heart.
Okay.
It can be as small as under the microscope, kind of a thing as well.
Very interesting. Okay, our final break is here. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
The warmer weather is here. Hi, this is Brad White from the Medicine Center Pharmacy. Perhaps you've gotten the urge to venture outside and clean up the garage or do some yard work, resulting in muscle aches and pains. If you have sore muscles or aching joints, you may want to consider a prescription pain-relieving cream available with a prescription at the Medicine Center Pharmacy. Our pharmacist can work with you and your physician to get topical pain creams that can be rubbed directly on the source, reducing inflammation and pain. Topical creams avoid troublesome side effects and dependency issues that can be caused by oral medications. The Medicine Center Pharmacy has an accredited compounding laboratory, and it is your source for custom medications. Custom compounded pain-relieving creams, available only at the Medicine Center Pharmacy, where wellness begins. Visit us at medshoprx.com for the pharmacy nearest you. That's medshoprx.com.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
You won't want to miss this upcoming Kiko auction May 9th with auctioneer Bill Gill Jr. You'll find old sports memorabilia, including baseball bats and mitts, comics, dolls from the 1950s and 60s, Coca-Cola advertising pieces, a beautiful oak bench, oak queen bedroom set, and even a set of 4 like-new 24-inch Dale Earnhardt brand tires with wheels and more. On-site and online bidding is offered. Mark your calendar for Wednesday, May 9th at 3 p.m. at 3201 Parkway Street Northwest in Canton. Call Bill Gill Jr. at 330-418-8727 or visit KikoAuctions.com for more information. Welcome back to Health Matters. Today you're listening to Dr. Rizwan Sardar from Altman Specialized Heart and Valve Center. We've got a lot more to cover this morning, so let's get back to the show. Where are we at? I think we've gone off program here a little bit, but what about risks with this?
Yeah, so the risk of the procedure, Paul, they are very few. I basically quote everybody that your risk of atrial fibrillation in the device which we are using, if you don't take blood thinner, your risk is average above 3 to 4%. Anyways, if you go for this procedure, the risk is not zero either. The risk is about like 1 in 1,000 of having something bad, which is like bleed around the heart. And even if you have bleed around the heart, 99% of the people do not have any life-threatening bleed. So it's very safe procedure. It's actually safer than heart catheterization.
Well, the risk to, a lot of the risk has been removed by not having to tear the chest open. Would that be correct to say?
Correct, and less bleeding.
Yeah, okay. Okay. So, how do you put this thing in?
We put this thing in by going from the groin-like heart catheterization, but in a vein. This procedure is generally performed under general anesthesia at this present time. However, there are changing ways that we are putting this device, and in fact, we were the first hospital probably in the country or in the world who actually did this device very recently in somebody who was totally awake without an echocardiogram. So there are new ways that we are developing to minimize the trauma, to minimize the duration of this procedure. But generally this procedure is done in the patients who are under general anesthesia. It is not at all painful. It is just like heart catheterization. If somebody is not familiar what heart catheterization is, it's by going from the groin into your heart, and we numb this up very well, and general anesthesia, basically you are at sleep.
The groin reason is because that's a large vein.
Correct.
As opposed to going through the arm or something along that line.
You're absolutely right.
Physically, how large is this device?
This device is probably 27 millimeter or 30 millimeter.
Okay.
The maximum size of this device is actually 33 millimeter, but when it compresses, it becomes 33 millimeter.
That's pretty big, isn't it? I think. I don't know.
But it's cramped so that it can go inside the body.
Okay.
And patients can return to work within 2 to 3 days.
And you say 1 hour, roughly?
1 hour, roughly, the procedure. They can go back to work in 2 to 3 days, and they don't have to take blood thinner for the rest of their life.
Interesting. Wow. You're up.
I think I'd like to give you a moment to talk to our audience and just tell them the most important things that you want to make sure they take away from this conversation today.
Okay. Thanks. Thank you, Nancy and Paul, for having me here. I would basically convey the concluding statement that patients should be aware that atrial fibrillation is very common than they think. Atrial fibrillation, which in short I would probably say irregular heartbeat, is life-threatening. very increased risk of stroke. There are only 3 modalities of treatment that are available. Number 1 is controlling the heart rate, which are basically heart rate controlling medication. Number 2 is blood thinner, which is life-saving. It prevents stroke. If somebody is not a candidate of blood thinner determined by their doctor, any doctor, it may be a primary care, it may be a cardiologist, or even an emergency doctor, or a nurse practitioner. If they think they're not a good candidate of blood thinner, they should try to look for opportunities where this device can be implanted, and they don't need to be on blood thinner for the rest of their life. Whether they are not a good candidate for the blood thinner because of their profession, because of their bleeding episodes in the past, because they are just not a good substrate to be on blood thinner, and last but not the least, it can be their own choice.
So how do you monitor this device to see if it's working?
By echocardiogram, which is ultrasound of the heart.
Okay,
it is real time.
But there's no external device like a pacemaker, or where you can, I guess, plug into that or whatever.
That's a great question. So when we put the device in, first of all, we have a real-time ultrasound guiding us to put the device. We see that it is working. Number 2, after 6 months, when we repeat an echocardiogram, it just becomes the normal part of your body. It just seals off, like your body basically develop a thin layer over it, and it becomes a normal part of the body.
So it's not electrical. It has no. Okay, so you don't need to replace the batteries or anything, or the device. Okay.
Once it is in your body, it stays there for your life.
Okay. So it will last for my lifetime?
Forever.
Amazing.
Just like a stent. It will be there in your body for the rest of your life.
Okay. I guess I sort of thought of it as like a pacemaker where you had batteries or something.
Fortunately, it doesn't need a battery.
Where does the pacemaker fit in this cardiac scenario? I know it's a pulsator, electrical impulse,
Correct. Some people have electricity issues, like they don't have enough electricity in their heart, and that is a very different, problem. And if somebody has electricity issues or their inherent pacemaker is not working, they do need a pacemaker.
Interesting. That's amazing that you developed a device that's lasts forever.
Actually, people think it's a new device. Just for everybody's listener, your show's listener, this device was first tested in 2005.
Huh. Okay.
Yeah. So it's not a new device, actually.
You have any idea how many are implanted? How many are out there?
Actually, I don't have an accurate figure, and I don't want to give you misleading statement, but there are many, especially in Europe. United States is actually a little bit behind in technology as compared to Europe, but I don't have an accurate statement on that.
So this has been in Europe for a long time?
It is there in Europe for a long time, longer than US, but I must say that it must be 100,000 or maybe more devices have been implanted in the U.S., but I don't have an accurate statement on that.
Wow.
Doctor, if some of our listeners are interested in talking to you more about this device or this procedure, how could they contact you?
We have Altman Specialized Heart and Valve Program. We have support services there. We have valve coordinators. We are having a service which is available, and numbers on the website to reach out over there. And they can ask about this device. If somebody can call, this device is Watchman Device, or if somebody can just tell them that we are interested in knowing more options for atrial fibrillation, which are non-pharmacological or without the drug. My office and my heart center understand what they're talking about, and they can reach me or they can reach our staff. We have information material for them. If they're just interested in knowing and reading about it, we can provide them.
Very good.
Let's say I had an issue. Would I have to be referred to you by a general practitioner? Or?
Well, that's a great question, and thank you for bringing it up, and I'm going to just quickly tell you, no, you do not need to be referred to me by the general practitioner only. Any physician of yours can refer you to me. There are few physicians who are ER physicians. They have referred me these patients. Yeah. No, you do not need to be a cardiologist to be referred. You can be referred by your general practitioner, by your nurse practitioner, by your neurologist, by physical therapist, anyone.
Wow.
Thank you, Doctor. Wonderful conversation today. We learned an awful lot. I'm sure our listeners did too. Dr. Rizwan Sardar from Altman Hospital. We'd like to remind our listeners, if you suspect you have a medical issue, Don't delay. Please contact your healthcare provider. Thanks to our sponsors, Studio Arts and Glass, Chemthorne Motors, and, of course, our technical producer, J.D. DeAngelis. As always, we thank our listeners for joining us on Health Matters with the Medicine Center Pharmacy. Tune in next week when we talk with Nicole Haynes and Tara Barker, cancer nurse navigators from Mercy Cancer Center. Have a healthy week. We'll see you next Friday right here on News Talk 1480 WHBC.
Thank you for joining us for this edition of Health Matters with the Medicine Center Pharmacy and your hosts, your pharmacists Paul White and Brad White. Remember, you can get more information right now at medshoprx.com. That's medshop.rx.com. Be sure to join us next Friday at this time for Health Matters with the Medicine Center Pharmacy. The preceding program was sponsored by the Medicine Center Pharmacies.